Dear friends, I'm Dr. Alifia Papai. I'm a practicing gynecologist at Sefi Hospital, Bombay, and today I would be talking on breastfeeding. Basically, first you need to know which is the organ that actually is responsible for the production and letdown of milk from the breast. Whenever a baby suckles at the mother's breast or the mother is loving her child or caressing her child, impulses go to the brain. The brain then releases two hormones, one is prolactin and oxytocin. Prolactin is the hormone that causes the milk production in the mother's breast, and oxytocin is the hormone that causes release of milk from the mother's breast. Hence, it's very important that the mother should always think positively and lovingly feed the baby. Which are the various positions with which you can hold the baby while breastfeeding? One position is the cradle hold, which is most commonly used, where you hold the baby with the same hand as that of the nursing breast. The baby's head lies in the crook of the elbow, the body lies on the forearm, and you nurse the child. The other position is the cross cradle position, in which you hold the baby with the hand opposite to that of the nursing breast. Like supposing you hold the baby in the left hand when you're nursing from the right breast, the baby's head is held on the palm and the body again lies, or the back lies on the forearm, and you nurse the baby. You can use additional pillows for support. And the other position is the rugby position or the football position, in which you hold the baby as if you're holding a football or a purse. You hold the baby's head on your hand, on the palm, and the body of the baby lies under your arm. So this is the way how you feed, and you can use a pillow under the baby for additional support. Now this position, or the rugby hold position, is generally used by mothers who've undergone a cesarean section. The other position is the side lying position, in which the mother is lying down, she tilts to one side, and with her hand she draws the baby closer to her, tilts the baby and feeds the baby. In this position, it is essential that the mother is in an awake state and she cannot doze off to sleep. And after nursing, the baby has to be put back into the cradle. What is most important with all these feeding positions is that the mother first has to be in a comfortable, relaxed position, any of the positions in which she finds comfort, and then she takes the baby. Her shoulders have to be relaxed, her back has to be straight. She can sit either on an armchair, or she can sit on a sofa, or she can sit on the bed. Also, whenever you nurse the baby has to be tilted towards the mother. The baby's back has to be tilted so that the stomach of the baby and the mother's stomach are almost touching. The baby's head, neck, and shoulder has to be held firmly against the breast, rather than the mother bending forward to feed the child to get the breast into the baby's mouth. Now, how would you latch the baby? So when a baby is born, there are certain reflexes with which the baby is born. Some of them are the rooting, the sucking reflex, and the swallowing reflex. Now, these reflexes generally are inbuilt, generally at the end of the 8th month, that's around 34 weeks. When the mother rubs the nipple on the upper lip of the baby opens the mouth. This is a reflex. You don't have to teach the baby this. If you rub the nipple on the left cheek, the baby will turn the head to the left side. If you rub the nipple on the right cheek, the baby will turn the head to the right. So when you touch the nipple on the upper lip, the baby opens the mouth. When the mouth is nicely widely open, you have to draw the baby's head, neck, and holding the head, neck, and shoulder closely to the breast with the chin first, and then the baby latches on the areola. Generally, you give the lower part of the areola more as compared to the upper part. And when the baby latches properly on the areola, the lower lip of the baby is generally flanged out. It's a little out pouting like this. And what is the areola? Is that big circle behind the nipple. So when the baby suckles, the baby is actually suckling on the areola and not the nipple. So this way, there is no pain when you breastfeed. Very important to latch properly. In case if there is any pain when you're breastfeeding, you have to again take the baby out and latch again. So to take the baby out from the breast, don't just pull on the baby's head and pull your breast back. That will cause a lot of pain. First, break the suction. How do you do that? You place your little finger in between the baby's jaw and the breast tissue. So the suction releases, you detach the baby from the breast, and then you latch again. You have to be extremely patient. In the first 1 or 2 weeks, the mother is always lost as to breastfeeding and recognizing the cry. But be patient with your child and work with the child. Getting comfortable with breastfeeding takes time for you and the baby, but you should not be discouraged. Once you and your child are in sync, then breastfeeding is the most pleasurable experience. Now, how often would you breastfeed? So, initially, if a baby that is born of healthy weight, we say feed on demand, but maximum 4 hours. After 4 hours, it's preferable that you wake the baby up either by unwrapping or flick the sole of the baby. But babies who are born with low birth weight, we recommend force feeding every 2 hours. When you feed from one breast for at least 15 to 20 minutes. And then you release and then you burp the baby. When you burp the baby for at least 10 to 15 minutes, you hold the baby upright such that the area of the stomach of the baby is at the level of your shoulder. And then gently stroke the back and then the baby will burp. Why do we recommend breastfeeding from each breast for around 15 to 20 minutes is that the initial part of the breast milk contains more of water, that is the foremilk, and the second part that comes later on is the hind milk that has more of fat. So that is why when you give the baby 15 to 20 minutes of continuous feed from the same breast, you give an equal quantity of water and fat because the fat causes satiety and the water content replenishes the amount of water that the baby needs. Some mothers feed from each breast for around 5 minutes. In this, the baby does not get satiety because all that you're feeding is water. Now, this foremilk and hind milk is not there at birth. It comes after 24 to 48 hours, immediately after birth. What is produced by the breast is something known as colostrum. It's that sticky, pale yellow kind of a discharge from the breast. This colostrum is rich in fat and it has all the immunoglobulins that the baby needs for immunity. Even 2 to 3 drops of this colostrum as a feed satisfies the baby's hunger. The baby's stomach capacity at birth is just like a marble. After day 3, it becomes like the size of a ping pong ball, and at day 7, it's the size of a golf ball. So you don't have to panic in the first 24 to 48 hours that, oh my God, there is no milk. You have colostrum which is enough for the baby. Now, many times after you detach the baby after feeding, the baby starts to cry. That doesn't mean that your breastfeeding was inadequate. But many babies, they like to just hold on or latch on to the breast for comfort or for resting after feed. So when you detach, the baby feels uncomfortable and starts crying. And when you latch again, the baby latches onto the breast, suckles for around 2 seconds and goes off to sleep. So the mother generally feels that, oh, was my feed not adequate, that the baby is now again asking. No, not necessarily for feed. It's just for comfort, which is absolutely normal. Now, what are the advantages of breastfeeding? For the child, it's manifold. Breastfeeding gives all the necessary carbohydrates, proteins, fats, vitamins, minerals that's necessary for the overall growth and development of the baby. It provides you with all the immunoglobulins that the baby needs for immunity, whether it's of the ears, the eyes, nose, mouth, the respiratory tract, the gastrointestinal tract. It avoids constipation. It helps the baby with her IQ. What are the advantages for the mother? Of course, it's maternal bonding with the child. It helps you to recover from childbirth faster. Now, initially when the baby is born, the size of the uterus is like a cauliflower. And then it takes 6 weeks to reduce from the size of a cauliflower to the size of an egg, which is actually the non-pregnant size. Now, this retraction and involution of the uterus that happens over 6 weeks is under the influence of oxytocin. That's why many a times when you breastfeed, you also experience a lot of period-like cramps. That's because of oxytocin release in breastfeeding, which also causes uterine contractions. Also, it helps the mother in reducing the risk of breast cancer. It helps you to lose weight. It's not easy. Breastfeeding takes in a lot of effort and energy. You lose in addition 500 calories every day. And of course, it's more economical. Now, what are the common breastfeeding myths? First is your baby is nursing a lot, so you don't have enough milk. Is that true? No, it's false. Many babies, they like to just latch on either to rest or even for comfort. Next is after 20 minutes, your breasts run out of milk. Is that true? False. So, how do you know that your breastfeeding is adequate? One is when you're nursing your baby, you can hear the sound of swallowing of milk by the baby. Secondly, is you may find milk at the angle of the baby's mouth. Thirdly, is when you detach the baby from the breast and then you squeeze the breast, you will still see milk. And fourth is, of course, adequate weight gain that tells you that your breastfeeding is adequate and so is the milk supply. Your 4-month-old baby needs additional water. No, your baby doesn't. Breast milk will give all the water that is needed to the baby, and you can exclusively breastfeed the baby for 6 months. Exclusive feeding means only breastfeeding, not even giving water to the baby. And it's after 6 months that you can start weaning the baby. Can you breastfeed if you develop a fever or a breast abscess? Yes, you can breastfeed even from the same breast. Can you have things like moong, chana, coconut water, sweet lime? Yes, you can eat. What you eat is what you digest. It's the digested product that the baby takes through breast milk. So if you develop gas or bloating because of having moong or chana, doesn't mean that the baby is also going to get gas because you had moong. But if you develop a flu, that you can pass on to the baby not through breast milk, but when you accidentally cough or sneeze while holding the baby, then the baby can also develop a flu. Do you breastfeed after 1 year? Yes, you do. You can feed the baby even up to 2 years. Do formula fed babies sleep better? Formula feed generally is very heavy and it's difficult to digest by the baby. So when a baby is given formula milk, the baby generally sleeps for around even 5 to 6 hours. Mother's milk, on the other hand, is very light on the baby's stomach and extremely easy to digest. So the baby wakes up more often on mother's feed. Some mothers use formula feed at around 11, 12 o'clock in the night so that the baby sleeps for a major part of the night for 4 to 5 hours. But this is highly not recommended and absolutely not desirable and highly discouraged. What are the contraceptive methods that you can use while breastfeeding? Of course, you have the barrier. The other is the IUCD, which is the intrauterine devices, or you have the progesterone-only tablets or injectables. We generally don't recommend the combined pills containing estrogen and progesterone because that would reduce the breast milk. A newborn baby has only 3 demands: warmth in the arm of its mother, food from her breasts, and security in the knowledge of her presence. And who do you think satisfies all these 3 demands? Of course, it's breastfeeding. Thank you for nursing your baby.